Thank you all for joining us. I wanted to just bring a little awareness of breastfeeding. So some of you may know that last week was World Breastfeeding Week, and breastfeeding is something that I believe is so very important. So today I wanted to just kind of share some of what I've learned about breastfeeding as an OBGYN. And then also I have two of my friends really, but these women are experts on breastfeeding. So together we are going to just kind of help you with some of the understand some of the benefits and bust some of those myths about breastfeeding. So what really got me passionate about breastfeeding is that I learned during my residency that African American women at around 6 months of age after having their baby or 6 months after delivering their baby, only 28% of those women will breastfeed. And then of those 28%, only 8% are exclusively breastfeeding. And so initially I was like, so that statistic cannot be true. I have so many family members and friends who breastfeed. But then I started asking my patients, and one by one, they told me, nope, not going to breastfeed. Nope, I'm not going to breastfeed. And so I started to just wanting to learn more about breastfeeding, encouraging women about breastfeeding, because there are so many benefits to breastfeeding. And it's really, really important. So I wanted to introduce to you the ladies who are with me today. And so Dr. Green, if you wouldn't mind introducing yourself to our group here.
Good afternoon, good evening. My name is Dr. Ashley Beasley Green. I am actually a bioanalytical chemist at a federal lab by day. And in the evening, I'm actually a certified lactation counselor and a proud mommy of 4 and currently nursing. Thank you.
And Dr. Barr, if you could introduce yourself as well.
Yes, hi, good afternoon, good evening, everyone. My name is Dr. Alexis Woods-Barr. I am a postdoctoral research associate with the Carolina Global Breastfeeding Institute, and that's at University of North Carolina. I'm also a proud mom that I've nursed my baby for 3.5 years. So I'm really excited to have this conversation with you and just share a little bit more about what we know.
Awesome. So thank you all for joining me. And I wanted to start just by talking about some of the benefits of breastfeeding. So one thing that's so unique about breast milk is that it is very specific for our babies, for human babies. The nutrients or the composition of breast milk actually changes over time to meet the specific needs of a baby. So within a day, even over months that a woman may breastfeed, the milk changes to meet that baby's needs. And 2 women will have breast milk, but they won't be made of the same thing. So I just find that so amazing about milk. The other thing about milk is not just for a nutrient source. So breast milk also helps with the development of a baby's brain, and it helps to fight off certain infections. So research has shown us that women who breastfeed their babies tend to have fewer ear infections, less illnesses with diarrhea, less respiratory illnesses. They generally won't have issues with eczema or asthma. Even later in life, their risk of obesity and diabetes is reduced. Breastfeeding has also been shown to reduce the risk of developing leukemia. And something that's even more important, especially in the African American community, is breastfeeding reduces sudden infant death syndrome, or SIDS. So there's so many reasons why we should breastfeed, not only for the health of the baby, but also for the health of the mom. So breastfeeding has been shown to actually reduce the amount of stress a woman may experience, especially in those first few weeks or months after having her baby. It promotes bonding. It kind of creates that quiet time that a woman can just really spend and learn more about her baby and the needs that the baby has. Additionally, breastfeeding can reduce the risk of breast cancer, ovarian cancer. It can reduce high blood pressure and even diabetes in women who breastfeed. One of the things I always try to promote in my patients is that breastfeeding is a natural form of birth control. So many women don't want to use hormonal birth control. So breastfeeding is one of those things that will delay your return of ovulation, delay your return to fertility. It can help you space your pregnancies out for at least 1 year after giving birth. And then it's cheaper. So if you breastfeed, you can save over $1,000 in formula within that first year. So there's so many reasons why we should all try to breastfeed or encourage our loved ones to breastfeed, because it's not only beneficial for the baby, but it's beneficial for the mom. So I was going to start by asking Dr. Green a question. So Dr. Green, what can a woman do while she's pregnant to prepare herself for breastfeeding?
Great. I think that just like when you're preparing, when you're pregnant and you're preparing to deliver, you go to educational classes or read books. I think the same you can do for lactation and preparing to breastfeed. Education. Breastfeeding education is very important, whether you are connected to a support group, you're researching online, or you're talking to any of the lactation specialists at the hospital where you're delivering your baby. Education is very important, and get connected with a lactation support group or identify a counselor. The earlier that you can identify, a person that can support you through your breastfeeding journey, the better. I think it's very important because you never know, you may need to ask a few questions at odd times of the day. And another thing that we often maybe not think about is to obtain all your supplies that you may need to breastfeed before the baby arrives, if possible. Your pump, any type of lactation creams or special nipple things that you may need or find online to prepare for that moment. And also free up your time, because when you're breastfeeding, it's really a lot of time and energies that you're devoting to the health and wellness of your baby. So I would, try some creative ways that you can free up your time before having the baby. So it's a little bit weird, but if you think about a baby shower, but you can also think about a frozen food shower. And so that's where people will bring you cooked foods or pre-cooked food or non-cooked foods that can be placed in the freezer. And so after you have your baby, you can just toss it in the oven or warm it up. And that, reduces some of your time there with cooking. Also maybe have a house prep party where, your friends or people would come over and help you prepare your house for your baby. Anything that you can do to reduce and free up some of your time will, definitely help you before having babies. So education, supplies, and, preparation.
Right. That's some great advice. And a couple of things that Dr. Green said, you can certainly talk to your OBGYN about. So a lot of health insurance companies are providing free breast pumps, and you can talk to your OBGYN about maybe getting a prescription to send to the insurance company so that you can get that free breast pump. And then she also mentioned the support groups or the breastfeeding support classes or education classes. So your OBGYN or the hospital that you're planning to deliver at should have all of those things available for you. Even now with things being kind of shut down, they are still doing a lot of these things virtually. So be sure to ask those questions when you go in for your prenatal visit. Now, Dr. Barr, one of the things that I noticed a lot, or a lot of women say during their prenatal visits to me, is that they will try to maybe breastfeed, or that they don't want to breastfeed because it hurts. So what would you say to encourage these women to breastfeed?
Yeah, well, first, I think validation is in order, right? Validating their concerns. There's a lot of mixed messages that are out here, horror stories about breastfeeding. So I really can understand why a woman may not fully commit up front, right, to doing to the act of breastfeeding, or they may be nervous, right, that they're going to have sore nipples or pain. The reality is, new moms are hormonal, we're overwhelmed, we're sleep deprived, plus other things, right? And so to add that pressure of trying to also think about breastfeeding may be a little bit overwhelming. So I think it's really important to again, to validate her concerns, reassure her that many of her fears and worries are likely unfounded. Breastfeeding isn't perfect. Yeah, we know that, but there's a chance, a good chance that she'll have little worry when that time comes because she's already run into complications in life and she's already overcome them. So she's going to be in just, good enough shape to do this moving forward with breastfeeding. And if we think about the soreness and the nipple pain, for some women, yes, breastfeeding can be painful or uncomfortable. In the beginning, they can experience cracked nipples, blisters, bleeding, etc. Right? But our bodies do adjust. Within the first few weeks, our nipples toughen up. But most important, I think, is the latch. That is the most important reason why many women experience that pain to begin with, is an improper latch. And so I think it's important for new moms to learn how to properly latch the baby, how to hold the baby while nursing, and learning how to latch and unlatch can really decrease some of that pain. We can also think through like lanolin creams to prevent that damage or to heal some of those cuts, maybe Tylenol, but overall relaxing, because stress does not make breastfeeding easier. It actually could exacerbate some of the issues that we're already feeling. So the good news is we're all different and every baby is different. So what you've heard may not be your experience. And so that's the good news, just knowing that moving forward.
Right. So, like she said, we all hear those horror stories, but it doesn't mean that it's going to be you. It's not really a reason to give up before even trying or not even try. So definitely, use the resources that you have, educate yourself, and just, make the effort. And so Dr. Green, I wanted to kind of just piggyback on that question. If a woman is kind of past, those first couple of weeks, she's still having pain with breastfeeding, what can she do in that situation?
Yes, if you are still having pain, issues, I would encourage you to reach out and get some support. Don't continue to try to do it on your own. Don't put yourself in a situation where you give up because you're either experiencing the pain of breastfeeding or you're just exhausted. I would encourage you to reach out to someone, even if it's to your OBGYN. They may be able to put you into contact with some really good lactation specialists and counselors. And if you've taken that time before having baby, you may already have a wonderful contact with a lactation specialist or counselor who can, you can reach out to and they can help you. And during this COVID, you may not be able to have that physical one-on-one. I know a lot of individuals and organizations are doing Zoom one-on-one meetings. And so they need to really kind of get in and see what you're doing. I think the number one piece about lactation and the pain and associated with it is the latch. If the baby's latch is incorrect, that's where a lot of your pain is going to come from. And it's really, really horrible. And you will want to give up. But if you can get that latch correct, get someone to help you get that correct, it'll be great for you. It'll be great for baby. You will feel comfortable and baby will get all of the nutrients and the liquid gold, as we like to say, that they need in order to be healthy. So don't try to do it yourself. Reach out, get some support immediately. Don't just keep putting it off. Just reach out, don't feel bad. We all have to say, I need help every now and then.
And don't wait until that point where you're already giving up. Once it becomes difficult, once you start to have those questions, reach out at that point. Try not to give up. Try to reach into your resources before just giving up on it altogether. And so, Dr. Green, as well, for a woman who may feel like breastfeeding is inconvenient because no one else can feed the baby if she's breastfeeding, what advice would you give to her?
I would just like to, before I answer this question, to say that you have a wonderful opportunity to give your baby something that no one else can produce, recreate, to the exact extent that you can specifically for your baby. This liquid was made exactly for the needs of your specific baby. And so you have this wonderful opportunity. And yeah, it takes a lot of time and effort and energy on your part, but just look at how you're setting your baby up for the rest of their lives as far as health and brain development, as Dr. Peterson said. So instead of looking at it as a chore, think about this. You have a wonderful opportunity to transfer yourself into your baby in a wonderful way. And yes, it requires something of you, but the return on that is more than a lot of the energies you will exhaust. But there is some aid, you know. I know a lot of times we think about having the baby at our breast all the time, and that is a wonderful experience. I enjoy it. I know my child enjoys it, but you have a partner that can actually help, or whoever that's helping you, your mom, aunt, uncle, it doesn't matter. You have people that are, you know, if you have people that are helping you in a really good support system, they can get in the action of feeding as well. And so you can do that by pumping milk. I know a lot of times you just think about the breast, but it's okay to pump milk, because ultimately what our goal is to have a healthy baby. And whatever route you go about that, in the way that you transfer the milk to the baby, whether it's at the breast or from a bottle of milk that you've pumped, it's okay. So I would, you know, encourage women, you know, if they want to, you know, tap into those support systems, if they're feeling really drained, pump some milk and allow someone else to feed the baby, and take that time to take a nap or just take a breather. So it's okay.
And I'm glad that you made the point about breast milk being very specific and unique to moms. I mean, this is really your opportunity to start your baby off with the best, you know, health that you can. This is your chance. You know, not only were you doing that during your pregnancy, but now that the baby is here, you know, give your baby the best start to life that you can. Yes, you may run into some obstacles, there may be some challenges, but if you made it through 9-10 months of pregnancy, I assure you, you can overcome those challenges as well. And so I wanted to ask Dr. Barr, a lot of women do have to return to work, or even school. What do you recommend for these women who want to breastfeed?
So I think going into it, we have to know that support doesn't always look the same for every person in every employment or school situation. So I think the idea that we've been trying to get across, at least this far, is to plan, right? And so for those returning to school or returning to work, it could ease the transition a bit if you're able to have a conversation with either your professors or your employers about what can be done, right? How does that support look for you? And remember, I said not all jobs support the same. So there are some employers that won't support at all, right? And so there are some things that you can do to help encourage them to provide those accommodations. So there are supporting nursing moms at work solutions or toolkits that you could share with your employer. Also, knowing your own rights, knowing that there's a federal break time in nursing for mother's law. And so this law really requires that some employers, not all, but most employers provide reasonable break time for their employees to express milk for their nursing child up until about 1 year. And this includes functional space, so not a restroom to pump your milk, and time as well, the time that you need to express your milk. Among other things, I would like to encourage women to also explore childcare options and find out whether the facility that they're choosing is breastfeeding friendly, meaning they will feed your baby your pumped milk when it's time to feed your baby. And also make sure they're okay with you stopping by to feed on demand, or if they have a place set aside for you to sit to do those things. So planning ahead, I think, is the biggest key for those who are planning to come back to work or go back to school.
Thank you for that. It is important I think to just have those conversations, like Dr. Barr said, she had mentioned earlier, you may be the first person at your job to even make that request, but that's okay. There are other women who will probably come along behind you who will need that same support. So if you're the first one, like she said, know your rights, know the employee laws, and make that request. I mean, all they can say is no. So definitely, do what you feel like you need to do to give your baby the best start at life. And so, speaking of milk, a lot of women, Dr. Green, have questions about their milk supply, and they get really frustrated or feel overwhelmed when they feel like they are not producing enough milk. So, what should be done in this situation if a woman is just unsure about if she's making enough milk for the baby?
Yeah, I think that's a very common thing that I see with a lot of women. And it actually leads to them stopping to nurse and then going to formula because they are unsure. But I would say this, it's important to watch your baby and see how your baby responds to your milk. If you feed your baby and your baby doesn't quite fall asleep, that is a good inclination that maybe that baby isn't getting enough milk. And it's okay. You can actually continue to nurse them because you can't overfeed them with breast milk. They're gonna, process that really fast. And before you know it, they're hungry again. And another thing you can also do is don't be afraid to pump your milk, to actually see how much output, how much milk you're producing. It's a good way for you to be comfortable with, okay, I am putting out this much milk, so maybe there's something else. And I can't reiterate this enough, that latch is super, super important because your baby could be nursing and, falls asleep super early before, the 20 or 30 minutes. But really, because the latch wasn't properly done, they may not get enough milk. So although you're producing the milk, the baby may not be getting, the milk that, they need, which unfortunately it's almost like a circle, because if the baby doesn't get enough, then your body says, okay, it doesn't need as much. So then you stop producing. So it's really important to get the latch corrected. And so you got to utilize those resources, get in touch with some lactation counselors and, talk to your OBGYN, find some support groups, because if the latch is right, then you can be sure that the baby is getting enough. Because usually when babies nurse, right after they nurse, if they've gotten their full, they're really pretty much sleepy and they're down for a few hours, at least 2 hours. So pump your milk, see what your output is. And it's okay to give the baby the milk in the bottle, and it allows you to see, how the baby responds to certain amounts of milk that you've pumped. So, and if you notice that response is different from what you're seeing at the breast, and that is another inclination that maybe that latch isn't enough. And then if your baby wants to feed, it's okay. It's okay to feed them. Once again, don't try to, a lot of times we try to put our babies on a schedule. The first couple of months, just let them, or weeks or so, let them set the tone. And if they want to nurse more frequently, it's okay. So check look at your baby, see if, where they are, get a feel for if they want to nurse more, pump to see what your output is, so you can see if you're giving the baby enough. And it's okay to, you can't overfeed your baby breast milk.
Dr. Barr, did you have anything to add about, a woman knowing if her baby is getting or receiving enough milk?
Yeah, I actually really like this topic because this is not a USA problem, right? This is not a USA issue of feeling like your milk isn't enough. This is a worldwide issue. So I'm really thankful. I'm going to shout out my friend right now because this is her research, Regina Roy Romero, because this is what she's interested in, understanding this topic about perceived milk insufficiency. But it's really important that you can track your baby's wet and soiled diapers. This is another way to see if you're not able to look at output like Dr. Green was talking about with pumping. You can also try to track your baby's wet and soiled diapers. You can try to learn their hunger and fullness cues. And also there's something called cluster feeding, which I did not know about. Being a new mom, I wasn't sure, why is my baby feeding so much more now? Do I not have enough milk? When I first started in my after giving birth, I had so much milk, and now my milk doesn't seem to be as much. So there's two reasons. One is called cluster feeding, when the baby's just, rapidly eating. It's because they're just going through a growth spurt. And secondly, your body really prepares for multiples when you give birth. So your body's thinking, maybe there's twins, maybe there's triplets, let me increase this supply. But when the body realizes that it's just one baby, we can decrease the output. And then moms get worried very, very quickly because of that reason. And it's just a very natural process. Remember, milk production is supply and demand. So the more you remove milk from your breast, the more your breast or your body says, I need to produce more. And I know Dr. Green was talking earlier about it's a type of pumping that you can do in addition to understanding cluster feeding. Can you talk about that, Dr. Green?
Yes, Dr. Barr, it's definitely the same thing. It's comparable to cluster feeding, and it's called power pumping. And it's the exact same thing where you increase the frequency of your pump over an hour. So you would pump for, let's say, 10 minutes, off for like 5 minutes, pump another 10 minutes, off for 5 minutes, and you would do that for like an hour. And so that is the same as, a baby nursing a couple of times in an hour. So that will also increase your production because your body is saying, hey, I need to produce more because the baby wants more milk, or I need to make more milk. So it's called power pumping, which is the same as cluster feeding.
Okay, thank you guys for your input on that. And I, just want to emphasize the point, don't give up. If you feel like your milk supply has decreased or whatever the case may be, again, this is a time to tap into those resources, maybe pump like they're recommended just so you can see what you are producing, but just don't give up. There's a way to kind of figure this out before you give up entirely. And so kind of in the line of pumping, Dr. Barr, I wanted to ask about women who may not have started breastfeeding right away. So it could have been because they were sick in the hospital for a number of days or weeks and separated from their baby. Maybe their baby was in the NICU because the baby was born prematurely. So can a woman begin breastfeeding even after a few weeks, or so after delivery?
Yeah, that's the really cool news about our bodies, is that we can something called relactate or induce lactation. But the sooner, the better, right? So it takes some effort. And so how much time and effort really depends on, and the success rate really depends on how old the baby is, and then also whether the mom's body or her breasts have returned to that pre-pregnancy state, meaning without all those hormones, right? That's usually present during pregnancy and then soon after delivering the baby. It might be easiest to do during the first 4 to 6 weeks, but I know it can happen after that. Of course, I want to also recommend an IBCLC be in the mix when helping you move forward in that way. Also, if someone is thinking about attempting to induce lactation, so for those who may not have been pregnant, right? So you think about those families that have a baby from surrogacy, or think about co-nursing in same-sex relationships, or thinking about adoptive parents to newborns. So there's a few different methods that can be used to trick the body, right? So there's a Newman-Goldfarb protocol. There's others, but it's really tricking the body into thinking that it is pregnant. And in turn, it prepares your breast for milk production. And so this could be an amazing option for those individuals that are in those kind of situations as well.
All right. Did you have anything to add to that, Dr. Green?
Yeah, I mean, Dr. Barr pretty much hit a lot. Most of the big points is that, yes, you definitely can undergo relactation, but I will also add that it requires a lot of work, on your behalf, and you have to be really committed to the process. So that means, you may be up, at 2 o'clock in the morning and your baby is asleep because you're trying to get your ramp back up to those levels and producing that milk. So, I mean, you really have to work really super hard, but it definitely can happen. You are not, all is not lost. It can, you can definitely make the milk, because we're not talking about some special, process that occurs only when you have a baby. These are hormones. These are just simple biological material that we all have, right? And so you just have to get it in the right composition and the right levels, and you'll be able to pump. But it does require some work and definitely support from lactation specialists. And so, yeah.
Right. And one of the reasons I wanted to address this point or this topic is because a lot of moms do have babies who are in the NICU. And so they're separated from their babies, and those babies in the NICU, they are trying to give those babies breast milk. Breast milk is something that is so important for premature infants. It prevents some of the complications that they tend to face. So if you aren't able to provide breast milk for your baby, they will give that baby donor milk, which has been pasteurized and is safe for the baby. But if you wanted to kind of take over that role once the baby came home, or even when you're able to visit, it's okay to go ahead and try to produce your own breast milk. That'll be beneficial for your baby. So I wanted to, we're going to start closing. I thank you all so much for this great information. This has been so wonderful and so informative. I just wanted to ask you guys if you had any final words of encouragement, especially for women in the African American community that tend to have lower rates of breastfeeding. Is there anything that you would like to say to them specifically to encourage them to breastfeed, even if it's their 5th baby now and they want to start?
I want to say that I know that there are a lot of barriers within our community that prevent us from nursing, and you often don't get the support in hospitals that you would need. But I would encourage you to reach out to support groups that specialize for African American women. If not myself, Dr. Barr, there are other organizations that are targeted to African American females. This is, as I mentioned, this is a wonderful opportunity that you have to transfer yourself and all of those nutrients and all of those things that your baby needs to really thrive. Because we're talking about health, brain development. It really sets your child up for a wonderful, wonderful toddler years and beyond. I've had 4, and breastfeeding, I think, has been really, really helpful in I haven't seen any of the ear infections, the colds. You don't really see a lot of that with, breastfed babies. And the brain development, you do see, some of those early educational signs from breastfed babies. So I would just encourage you to get some support. You're not alone. Reach out and continue to transfer yourself into your baby, and so they can thrive.
All right, do you have anything to add to that, Dr. Barr?
Yeah, I mean, that transferring yourself, oh my God, it just makes me feel so good on the inside. Yeah, because breast milk is a living substance, right? It, like Dr. Peterson was saying, it changes over time to meet the needs of your baby. So I could go on and on about breastfeeding because that's my passion, but I have to say that a lot of moms incorrectly think, and it's not for no reason, but they incorrectly think that they're not designed to breastfeed. But in reality, society isn't designed to support breastfeeding and lactating moms at the moment. And so you have to surround yourself with those who are supportive, whatever that means for you. Support looks different for different people. And I had to learn that from my research that, with African American families, that there's just different ways to support, and you just have to be vocal about what you need. And contrary to what many people may believe, there's no right or wrong way to feed the baby, right? There's not a one size fit all for your options. So if you start out feeding one way, along the way, you can decide to change it if it's not working for you or your baby, or you can combine, like Dr. Green was talking about earlier. The ultimate goal is to have happy parents and fed and happy babies, okay? So finding your community, for Black communities specifically, there are a lot of social media groups, a lot of in-person support groups that you can cleave to if you're not finding it within your specific family, or if you're not finding it even in the medical community. Thank God for doctors like Dr. Peterson, because you're working with these mothers and families and trying to encourage it, but it's not always encouraged for Black communities. So you just have to find your way and be persistent. That's what I would say, until things change.
Right. And I think with conversations like this, you know, slowly but surely, it will be more supported in our communities and even in our society as a whole. So Dr. Barr, how can women find you if they have questions, more questions about breastfeeding?
Yeah, please reach out to me on social media. I'm on Facebook. My name is Alexis Woods on Facebook. Twitter is Dr. Alexis Woods-Barr. And my email is Alexis Woods-Barr at unc.edu.
Okay. And Dr. Green, how can they find you?
Yes, I have an email. It's lmlactation@gmail.com. Again, that's lmlactation@gmail.com. I'm not as social on social media with my kids and, you know, my career, but I definitely answer my emails, and I'm very responsive and quick. If I can't help you, I can always give you a resource and point you in the direction where you can receive that help that you need. But don't be afraid to reach out and get some help before the baby comes, while the baby is here. Just reach out and get some help. You don't have to do it by yourself.
Thank you. Thank you, guys. This has been an excellent talk. I appreciate you all both for joining me, giving so much more information than I could have done on my own. So thank you so much. If you all have any questions, feel free to leave a comment on Facebook. I can also get you in touch with these ladies if you weren't able to jot down their contact information. But it was such a pleasure being here with you both. And hopefully we can do this again. This was awesome.